Hi, I'm Dr. Michele Perez, and welcome to this episode of the Back Talk podcast. I'm a physiatrist with Resurgence Orthopedics and work in a couple of offices in the metro Atlanta area, our office in Kennesaw and Canton, and perform procedures at our outpatient center. I'm here today to talk about house divided. So we're going to talk about chiropractic care versus medical care or standard orthopedic care. So I'm here today with my husband, David Perez, who's a chiropractor and practices pretty much in the Marietta area, not far from where I practice. So we're going to kind of talk about the differences between medical care and chiropractic care, the training, sort of the different approaches we take, how we see things differently, because I know I get a lot of questions from patients about chiropractic, and I'm assuming you get a lot of questions from patients about orthopedic care in general.
Care, when to go see a physiatrist or
a surgeon. Yeah.
Exactly, yes.
Right. So I guess to start, we'll talk about our different training. So for both of us, it's standard undergraduate degree, 4-year degree, and then the schooling for chiropractic and medical schools are two different schools. Chiropractic school, is it a full 4 years?
It can be a full 4 years,
full 4
yeah.
years,
I
right?
did it in 3, but yeah.
And then medical school is traditionally a full 4 years.
Correct.
There's a lot of schools around the country. You specifically went to Life University.
Yep, I went to Life University, correct.
Right, so that's how we ended up in Atlanta for chiropractic school and for me to train at Emory for my residency. So,
and I've been a solo practitioner now for 20 years, just over 20 years actually, in the Marietta area, like my wife said. And we've, had patients back and forth.
Share a lot of patients. Sometimes you steal them from me. But,
correct. They like me a little bit better.
You've stolen quite a few.
Right. But yes, they do ask a lot, my patients that is, when is the best time to go see a orthopedic surgeon or a spine surgeon or a physiatrist. And we tackle that as far as back pain, neck pain. Chiropractic does do, obviously, it can help with back pain, neck pain. But we don't, I guess we say we don't cure anything. We just help the body express itself at its best potential by removing any interference, whether it be subluxations, misalignments, that can be causing that discomfort, right, in the back or the neck, wherever the area may be, and therefore allowing the body to then express itself in its best possible way. Sometimes it doesn't always work, and that's when we then have to refer out.
Sometimes it's the other way around.
And sometimes it's the other way around. And it's the best of both worlds, honestly. Obviously, now chiropractic has been more accepted by the medical community.
Sure. Somewhat more mainstream.
More mainstream
in the
now.
South, at least, yeah.
Correct.
Yeah.
And being married to one, that definitely accepts it. You've had your share of questions from patients about chiropractic, right? So.
Yeah, and I think it's the practice, especially the surgeons and the other physiatrists feel comfortable that they have a chiropractor they know in the community that will do the right things. Because, some people joke that there's a chiropractor on every corner, and so who do you go to?
Correct.
It's not like a big medical practice where you have huge medical practice and okay, it's Resurgence Orthopedics or some other practice in town. You guys are usually solo, so it's really hard to know where to go and who to start with.
And where the good ones are.
And where the good ones are, right.
Right, and that's the thing about it. Yes, so it's best if you're referred by either a physician or somebody or a personal friend that has had, some kind of experience with that particular doctor. But just picking them out of the yellow pages back in the day or now social media, it's kind of tough. You're taking your chances. But
that's why I usually tell people it's better to go with word of mouth, either from friends, neighbors, other physicians.
Right.
The challenge has always been in the medical community. I've been doing this for 20 years now. Is that chiropractic has not always been very accepted as a mainstream treatment because of just bad media, maybe, I guess, or, there's bad apples, right? There's bad apples in the community, just like there is in medicine. So I think it's gotten kind of a bad name, but I think in the orthopedic community, spine community especially, we know where chiropractic can really help people, so we can slide people into those slots and niches where we need them, because we know, okay, you really aren't a chiropractic candidate, or you are. So I feel like we've gotten pretty good, especially at Resurgence and the guys and ladies who know you, of knowing when to slide them into something like chiropractic care.
A lot of times it tends to be a lack of understanding of what chiropractic really is and how beneficial it can be for you.
Right.
But once they understand and they get their first adjustment, they realize how incredible it really is.
Yeah.
Because getting adjusted absolutely helps. It makes everything feel better.
Yeah. So the common misconception or myth, I guess, that people always say, well, I don't want to go to the chiropractor because then I'm going to have to go forever. And that's like saying, I don't want to go to the primary care doctor because I'm going to have to go forever. You know, if you have a long-standing problem, you potentially going to have to treat it forever. And they think that it's like almost like you're doing some kind of voodoo and making them addicted to chiropractic. And so I explain to them that, well, the reason people keep going is because it helps and it feels better. You do feel better, but the body's changing every day. And those things that, just like a massage, it might feel good for a while, but things have to be continually corrected and what's the word I'm looking for? Tuned up, I guess.
Tuned up, yeah. And the thing is that in the beginning, you might need to become a little bit more consistent. I wouldn't say forever. But then because we want to make sure that the adjustments, they're going to hold, right? We call it holding when it's from 1 week to another week, and then from 1 week to 2 weeks, and then so forth.
Right.
So
till
once
things get more stable.
More stable. So once they become more, they're holding better, a better pattern. Then it's like once a month and a half, or whatever it may be. But it's not forever. But
if you want it to be forever, you can.
If you want to keep feeling better for a long time, then the more consistency.
If the condition stays stable,
then
that may, and I tell people that a lot. Sometimes if they come in with, let's say they've had a chronic problem for a while, chiropractic's kept them stable for a long time, then something happens and there's an acute problem, then they might come to us, right? You might refer them, or they self-refer, come in, deal with the acute problem, and then I always tell them, listen, if chiropractic has worked for you for 20 years, you should continue it, because I see a lot of success long-term with people who do chiropractic and tend to have less severe problems, and not always, but and better control their problems, and tend to be more active and more flexible. And so if they've never been to a chiropractor, sometimes I like to introduce them to it, because sometimes they come in and their situation really isn't there's no surgery necessary, maybe not even injections. So I might utilize chiropractic because maybe physical therapy hasn't been helping. And so I'm like, well, let's try something different, because there's that more hands-on manual.
And then when they come to me after you refer them, I tell them that it's not a one cure is going to fix all, right?
Yeah.
So it might be a little bit chiropractic, it might be a little bit injections, it might be a little physical therapy.
Right. The
massage,
multimodal approach, right.
Exactly. Right. That's going to make the whole thing work, as one.
Yeah.
But it's not a one cure fix all for everything.
No, and I think that's the case in many patients. Sometimes they're hoping for one thing's going to fix everything.
One injection, one pill, one something.
When the problem's a little bit more complicated, it might be, like you said, kind of multimodal approach, therapy and chiropractic. But then, and I often tell them, go ahead and, maybe use chiropractic for long-term maintenance, like go once a month, once every couple of months or something like that.
And some of the people that, when they it's their very first time coming to a chiropractor, I tell them the same thing about a dentist, right? Every 6 months, you have to go and get your teeth clean and whatnot.
Yeah.
So do you have to go forever? Well, if you want to keep pretty smile, pretty teeth, you have to go forever, right? Chiropractic is the same way. If you want to keep a nice straight spine and active as possible, be active as possible, then getting those adjustments, getting those tune-ups is going to help you in the long run to get the most out of your body.
For sure.
Right? As far as that.
For sure. So let's kind of talk about, because sometimes patients don't know where to start. And there's not always going to be, this is not always black and white, but typically I guess I can think of a couple of times when I would say no to chiropractic. People who should not maybe do chiropractic. Situations where there's like maybe an acute herniated disc in their neck or their back, and they're just experiencing severe nerve pain. And you guys in the chiropractic community typically agree with that. That's something that needs to be handled by either us in physiatry or spine surgeons or both. because of nerve compression,
Correct.
adjustments to the spine are not necessarily indicated,
Correct.
and may not necessarily worsen their situation overall, possibly, but definitely maybe not help it. So that's usually, patients will ask me, should I go to a chiropractor for this? And I usually say, not right now. Let's wait.
Correct. And the same thing with me. If they come in, if it's let's say a car accident or some kind of severe fall or injury, and depending on what I see, because we do take X-rays,
right?
And depending on what I see on my X-rays, if I notice anything like that, then absolutely I would say, yeah, right now chiropractic is not for you. You need to go see my wife, or I send them to an orthopedic surgeon or some that can evaluate further, right, into that condition.
Determine if chiropractic is appropriate.
It's appropriate, exactly right. Now, if it's just back pain, neck pain, from working out, from doing landscaping, something like that, something minor, absolutely chiropractic. I would definitely suggest chiropractic before you even go get an injection on that muscle or something to that extent.
Right.
Before, no need to get that invasive just yet.
Right.
Maybe treat it a little bit with chiropractic and massage before that. And if that doesn't help, then we move on further and
So I'd say a couple definite no's are you wouldn't treat any fractures.
Absolutely
so if there was
not.
any sign of a fracture or any thought that there was a fracture, any suspicion of a fracture of the spine or anywhere, any signs of ruptured or herniated disc in the spine, that usually is indicated by severe nerve pain in the arm or the leg, and usually you would say, look, this is something you're going to have to see an orthopedic doctor about.
Right.
Any signs of, something more systemic, like cancer or some illness like that, you would definitely refer out.
Yep.
So those are sort of the very distinct categories.
Exactly right.
And then sometimes after that, it might get a little gray.
Correct.
And then I think what you would do, and what I have happen a lot is patients will come to me after a few visits, maybe with a chiropractor, and maybe getting better, maybe not, and then just sort of come to see, okay, well, let's get your idea. What's going on here? Let's look at the X-rays. Do I need any other tests? Should I keep going? Should I not? Sometimes patients will come kind of for a second opinion in that situation.
Correct.
So, but that's just when you don't know where you're headed with something.
Correct. And the same thing with me. After so many treatments, visits, if I don't see them improving, even though it was a minor thing, then there might be something underlying there that I'm not catching, I'm not seeing. And we definitely refer out and go see the next, whether it be a physiatrist or orthopedic surgeon, whoever it may be. Exactly, that falls under that.
So I think the safe things are somebody who's had a rather minor, moderate accident. There's no neurologic injury or anything like that, or no bone fractures. That's a good place to start with chiropractic. Strain or sprain, doing stuff in the yard, the gym, something like that. Just, sometimes people just develop some acute back pain. If it's not agonizing and they can actually move around, chiropractic would be a good place to start. Always good to start with something conservative. And then, like you said, so how long would you say that you tell people, I know there's not an exact number, but usually we think, if after 4 to 6 weeks, if you're not making much progress.
Correct, yeah. I would say 4 to 5 visits.
Okay,
that could be... it could be once a week, so it could be a month, right?
Okay.
So, one time a week.
Depends on how many times
depends
you're
on
being seen.
how often they're coming, But like your weekend warriors, right? They're doing either landscaping, yard work, fencing, whatever it may be, washing the car, and all of a sudden they tweak their back, they tweak their neck, arm, or something. Those are the patients I think that you guys as a medical profession, it's like, why don't... Go somewhere else.
Maybe just more. We might be more than they need at that point.
Exactly. Maybe more than they need. And it's like you just give them a little prescription, whatever it may be. But then we take them in and really work on them, align them correctly. It's more hands-on.
Yeah.
Kind of like a massage, not a massage, but it's chiropractic care. But along with that, comes muscle rehabilitation and stretching, and that's what we do. So, and that can also just, that alone makes it feel better. Without having had to take an injection or medication or anything like that, right?
Yeah.
So weekend warrior type stuff is basically what we, treat a lot of mainly. And then obviously car accidents come to us because of the fender benders, back pain, neck pain that comes with that.
Of course.
As long as, like you're saying,
there's no
fracture, there's no bulging.
Red flags,
Red flags, exactly right, yes.
So I think we should probably explain kind of what an adjustment is. So because people sometimes ask, what's the difference between physical therapy and chiropractic treatment?
Yeah.
And so I the way I explain it, and you can explain what adjustment is like, is that physical therapy, yes, there's hands-on, but
Yes.
they're more often working with the soft tissues. Their
tissue,
flexibility, stretching, strengthening, their exercises. You're doing the it's active in that you're doing the exercises and they're guiding you,
Right.
and it is hands-on.
Right.
And there may be some hands-on mobilization
Right.
with a physical therapist, but
You may
not
have some-
manipulation,
correct.
which is the definition
difference.
where you go to chiropractic.
Right.
And I know there's different kinds of chiropractic. Some people do more of the kind of modalities like the activator and things like that, but you do what's called full spine. I think we should explain what full spine is. You treat, if it's your neck, you treat the neck. If it's your mid-back, you treat the mid-back. You treat the actual area because there's different theories in chiropractic about that.
True. A lot of people they don't want to treat just the symptom, but the cause of the symptom, right? So sometimes the symptom may be in the neck, right? Sometimes the symptom may be in the mid-back or whatnot, but by adjusting the neck, it could probably correct the mid-back problem, the mid-back pain,
Well,
right?
a lot of that stuff overlaps. So
Exactly, it overlaps. So, and the adjustment, like you were saying, what is the difference between chiropractic and physical therapy? Well, we deal with manipulating the spine, right? The vertebra. We call it subluxation,
Right.
which is basically a misalignment. It's causing some kind of impingement or interference
pain,
with whatever nerve that's directing the energy flow to whatever it may be. It might be going to your arm, the neck, the stomach. And so we believe that by removing that interference, the body then can express itself at its highest potential. That's what chiropractors don't tend to say that they cure anything, because that same adjustment can be given to another person and it may not work the same way.
Sure.
So we cannot say, come here, we will cure your earache or your headache or whatnot.
Right. And I think that's where it's better to stick to
just the adjustment, just doing a
stick to
cervical
that.
adjustment, just doing
Stick
a
to
back
what you
adjustment.
know. It'd be like me saying, I'm going to do this treatment for you for your hypertension. That's not what I do.
Exactly right.
What you're doing is you're treating their symptoms and you're trying to make their symptoms better, just like I'm doing, but just doing it in a hands-on way.
Right.
So I'm not doing any adjustments to their spine. I'm doing different treatments, but all of those things, can make a difference. And if anybody's ever had a good adjustment and a successful adjustment, it's amazing how surprised they are how good it feels because they're scared.
Exactly. Yeah, they're scared. Exactly right. Yeah, they're like, it looks like torture.
It looks and of course, there's lots of TikTok videos out there about that now.
Which is exactly right. Not putting a nice face on it. But to that point of the adjustment, right? So once we remove the interference, the subluxation for that matter, then the body can then express itself the way it needs to, and everything should start to feel better, like you're saying, and a great adjustment.
But you always tell people they do need to do other things too, right? Like stretch, because you're not going to hold that adjustment, as you guys call it, without doing other things to help themselves.
We will be bending and standing and doing, because that's life, right?
Life.
Getting out of bed and in and out of the car.
Right.
And you will probably misalign again. But the more consistent you become with it, the more stable that area becomes.
Sure.
By stretching, exercising, just working out, you make it a little stronger, and then it starts to hold.
Yeah.
Will it ever go back out? Probably.
Of course it will. Yeah,
of course it will. But hopefully it'll take a long time. It won't be the same pain, and it won't be it. And then once you become aware of your body, you know what to do. Hey, I got to get adjusted before I even run to the doctor or get a shot or something like that. Or prescription.
Right.
Exactly right.
Yeah. And I think, probably my issue is a good example, right? Because I've had that neck injury for years and did chiropractic for even, before we met, I did chiropractic. And finally realizing that even though I teach this to my patients, I wasn't doing it myself and did some physical therapy to make things stronger so that those adjustments would hold. So that's where it's complementary. And I think that's where, we're not all living on islands. Like you don't do something and then and then I go do something. It's truly all complementary, and it should be, and it can be.
Exactly,
so, and we shouldn't all be against each other.
No.
I mean, the joke is it's a house divided, but it really doesn't have to be.
It doesn't have to be. It could be the best of both worlds.
Sure,
that's basically what it is. And like I tell them, it's the bridge between the physical therapy and the medicine. Right? It's chiropractic, just like a car alignment. Right? You can change the tires all you want, but if you don't get the alignment done, you're always going to have ball tires, right? But if you get the alignment done, chiropractic-wise, then those muscles are going to work even better, right? So that's the bridge between, both of those things. So I think chiropractic does do that for a lot of people. And yes, house divided or not, but it's definitely the best of both worlds.
Yeah.
Yeah, absolutely. One question. Who is the real doctor?
Let's not argue over that. Let's keep that personal. So that wraps it up for today for our episode House Divided on the Resurgence Back Talk podcast. Thanks for listening.
Thank you.